Welcome to Pioneers in Healthcare. I'm Dr. Len Saputo. I'm board certified in internal medicine and have practiced for nearly 40 years here in the Diablo Valley. This show is about people who are special people who have made contributions to medicine that are unusual and outstanding. And today we have a special guest. His name is Dr. David Rasnick. He has a PhD in chemistry from Georgia Institute of Technology. He has 20 years of experience in the pharmaceutical biotech industry. He has studied HIV/AIDS since 1980, and he's the former president of Rethinking AIDS and the former president of the International Coalition for Medical Justice. He's a member of the Presidential AIDS Advisory Panel of South Africa, and he's worked closely with Peter Duesberg from UC Berkeley on the aneuploidy theory of cancer, which we'll do on another day. He's also was a senior researcher with Dr. Matthias Rath at the Health Foundation in Africa. He has a book out that's called Germ of Lies, which you can find on lulu.com. David, it's wonderful to have you here. It's such a privilege to be working with you today.
It's a pleasure to be with you.
We have kind of a long and interesting history because you're a researcher. You've been involved in the pit, okay, where the information comes out that tells the clinicians, the doctors, what's a fact and what's not a fact. And things have gotten all bungled up. And here we are now with a lot of different ideas about what HIV and AIDS mean, and maybe that's a good place to start. You know, people kind of make the assumption of HIV and AIDS, and there's a lot of controversy about whether or not that's true. What is HIV?
HIV is a retrovirus. It's one of at least 3,000 or 4,000 that have been cataloged, and it would be the first retrovirus to cause disease if it were true that it caused any disease at all.
So there's never been a retrovirus that's been known to cause a single disease in the history of medicine.
That's true. And HIV, I'm among many other scientists around the world, probably several thousand, that have concluded, based on the evidence, that HIV is completely harmless and it certainly does not cause AIDS or anything else.
So you're saying it's much like a PSA might be in prostate cancer, where the PSA goes up, but there's no point treating the PSA because the problem is it's a cancer someplace.
It's worse than that.
Okay.
It's totally worse than that. HIV has never been obtained from a human being. People should understand that. Retrovirus...
Never been cultured from a human being.
Never been obtained from a human being.
What does that mean?
For example, like if you have hepatitis or flu or a cold or measles or chickenpox, any viral disease, you can take a sample of blood, or at least from the wound or the pox.
You can culture it.
Don't even have to culture it. There's virus there that you can quantify without even culturing. You can culture, but typically you can spin it in a centrifuge and get a little bit of it in a vial, and you can quantify it. It will be infectious, viable virus that you got directly from the patient. If you put it into another human being, that will infect the other human being. That has never been done with HIV.
That's just really hard to believe. I mean, that's some of Koch's postulates. I mean, that's who's the guy who was the infectious disease, father of infectious diseases.
Yeah.
Who says you have to do that to prove that actually a disease is caused by a particular organism.
Well, HIV led the bandwagon where you can basically invent something out of thin air and turn it into a multi-billion-dollar, hundreds of billion-dollar industry. Another example would be the hepatitis C, which is even acknowledged by Chiron, which used to exist, the company that made the original hepatitis C test, that they never ever actually obtained hepatitis C. They just got bits and pieces of it and then inferred what this virus must be. And people to this day are being tested for something that has never ever been obtained from a human being.
Now, is there an association between people who are HIV positive and tend to get AIDS?
Yes, it's an association by definition.
Okay.
In fact, you cannot get AIDS by definition unless you have antibodies to HIV.
So you can find the antibodies to HIV virus. Does that mean that the virus is there if you can make an antibody against it?
No, it does not. In fact, the presence of the antibody, that's the principle of immunization. It means that your immune system is won out and it's defeated the pathogen, the virus, and it's gone. That's, for example, if you've ever had measles or the chickenpox. You will have antibodies to it, but the virus is not detectable.
So when somebody has something like mumps or measles or chickenpox, and they have antibodies, the illness is done.
Exactly.
They don't have the antibodies when they're sick. And that's exactly the situation you're saying about HIV and AIDS.
That's right. They generate it over time, and that's how they defeat the viral infection. But it's even worse than that. The inserts that come with the antibody test for HIV say explicitly in there that they have no reference standard to determine whether or not the antibodies that they detect positive in the test actually have anything to do with HIV. They don't even know if those antibodies are really from HIV because they have no reference standard.
Well, how did we ever get to a situation then? This is not making any sense. How could a logical physician or the whole medical profession come to the conclusions based on no evidence? Or is that probably a question you want to ask me? I don't know.
Well, I mean, I've asked myself that too, because when I was a young scientist in my early 30s, back in 1980, when this whole AIDS thing popped up, I was eager to get on to it, work on it like every other scientist that I knew. It was such a bizarre thing. You know, it was all these weird diseases I'd never heard of in my life were occurring, popping up exclusively in gay men. I mean, that's strange. I thought it was my Andromeda strain, you know, at the time, and I wanted to work on it. But I learned years later that the Centers for Disease Control had actually accurately figured out what AIDS was as early as 1982. They had discovered that it was a drug disease, that the reason that these AIDS diseases, these immune deficiency diseases and other diseases, were the direct result of chronic use of recreational drugs, amphetamines, poppers, heroin, cocaine, and things like that.
Okay.
How that changed was by decree at a press conference on April 23rd.
By decree?
By decree.
There's a scientific approach. I, the king, now say it's this way, so therefore it is?
Yes.
Is that what you're saying?
I remember it very distinctly because, remember, I was a scientist eager to know. I'd spent about 4 years wondering how I could apply my talents as a scientist to work on AIDS. But nobody really understood in the scientific world what was causing AIDS. And then on April 23rd, 1984, Margaret Heckler, the Secretary of Health and Human Services, brought out Robert Gallo of the National Cancer Institute and said that he had discovered the probable cause of AIDS. The very next day, they deleted the word probable.
And Robert became a fact.
It became a fact. Robert Gallo applied for a patent on his HIV test that very day. The federal government got behind it. Now the federal government, we taxpayers, as of this year, because of the latest legislation for the PEPFAR program, which had just voted in another $48 billion for African AIDS, we have now spent $250 billion, $250 billion on AIDS. American taxpayers have, just not the drug companies, not volunteer organizations, but the federal government has spent this money.
Wow.
And they have not saved the first AIDS patient. They use that fact to advertise more money to do AIDS research and to warn people about safe sex and condoms and things.
Okay, now people are talking, and one of the things I know you know a lot about is the infectiousness of this disease.
Right. Supposedly.
Well, that's what everybody says. You turn on the television set and you start hearing people talking about AIDS, and what they're talking about is be sure you have a condom, make sure that you're...
Sexual transmission.
Yeah, it's an STD.
Right.
And what does the data actually show? Is it?
Well, the first thing the data is clear on, absolutely, totally clear, is that retroviruses, remember HIV is a retrovirus, are not sexually transmitted. Even if it caused AIDS, it is not sexually transmitted. Scientists have known this for, well, I guess 50 years. You can fingerprint and mix a bunch of lab rats together, and this brand has a certain endogenous retroviruses. This one does. You mix them together. They do not transmit them sexually to each other. You can take them out, and you can identify what strain of rat they are by their spectrum of retroviruses, because they don't get mixed.
My goodness.
And the same is true with human beings. No study has ever shown, even with HIV or SIV, the so-called simian immunodeficiency virus, no laboratory experiment has ever demonstrated sexual transmission of a retrovirus, including HIV or any of its laboratory equivalents.
Well, then where did the whole medical profession get the idea that this is an STD? I mean, you shouldn't have to answer that, but you probably know the answer.
Well, it took me a while, because you see, again, we have a quarter century now of this stuff. And I started out being as mainstream as you can get.
Yeah.
I made organic chemist by training, and I've worked in arthritis, emphysema, parasites, cancer, and then AIDS. And so I thought, well, all I need is the target. you know, now we have a virus, and I know viruses have enzymes, and I try to make inhibitors for these enzymes. And then over the course of my being a scientist and being confronted with the contradictions of the results of the research data, you have to scratch your head and you say, wait a minute, retroviruses are not sexually transmissible. Nobody's ever obtained a viable sample, free infectious HIV from a human being. What's going on here? And it was clearly by certainly 1985, all up to 87 for sure, that AIDS itself was not a contagious disease. It stayed within the same risk groups. It was 8 out of 9 AIDS cases to this day are still male, and 60% are gay men.
So an infectious disease shouldn't be able to discriminate between one person and another, should it?
There's no virus that knows whether you're white or black, gay or straight, rich or poor, or what zip code you live in, except HIV, apparently.
Would you have any idea why the CDC is saying that this is an STD and that we should be careful? It's a sexually transmitted disease?
This is area for speculation because there's no documentation whatever. There's no study that shows that AIDS, even AIDS itself, is sexually transmitted. In fact, there's all of the studies that tried to quantify the efficiency of sexual transmission of HIV, by the way, have never succeeded in even coming up with an estimate that they could base it, that was based on scientific data. Zero. In fact, the largest controlled study, Nancy Padian, it was done, I think, in 1996, American Journal of Epidemiology, it was published in, showed it was a 10-year study. It was the largest of its kind. Not a single one of the there was these discordant couples. One was HIV positive, one was HIV negative. And many of them, probably most of them, I don't remember the exact numbers, did not use condoms or anything during the course of this study. Not a single HIV sexual partner, HIV negative sexual partner, became HIV positive during this. Nobody has ever demonstrated that an HIV negative person becomes HIV positive via sexual intercourse.
That's just shocking.
It is.
And yet the physicians, okay, I have to say that I feel very sorry for physicians. These are people trying to do the right thing. They're good people. They're clinicians. But they're not scientists. And they depend on the literature that's being published. And they also listen to the kinds of documents that come out of CDC and FDA about what's right and what's not right. How are we going to help those people to understand something in a different sort of way that gets the truth out there?
Well, money has killed the whole scientific process. I'm a scientist, and over my 30-some-odd years of being a professional scientist, I've watched it go from being one of the most democratic activities on this planet, far more democratic than any regular
and lots
political.
Of integrity. You
lots
wanted
of
to do
integrity,
the right stuff.
Really good people. It didn't matter who you were. You know, it's what you did and your integrity that you brought to this. I've watched that evaporate over the years, and the place where it's fallen apart the worst is the United States. Unfortunately, Europe has resisted, but they're caving in now and becoming more and more like the American thing.
You know, before you go on with this, I want to just substantiate what Dr. Rasnick is saying. He's saying that the literature that we have, the medical literature, the scientific literature, is no longer believable. And it's not just him saying it. Marcia Angel, who was a physician and chief editor of the New England Journal of Medicine, Catherine DeAngelis of the Journal of the American Medical Association, Ushma Anil of another major medical journal, have all quit their jobs and said they are disappointed, disillusioned, and can't believe the low quality of material that's coming across their desk that's published in their journals. And it's because of other factors. There are people who have an axe to grind, who have a mission to accomplish, who have an ulterior motive to be able to get their point across. So if a pharmaceutical company, for example, is doing a study, they're going to make it look the best they can. They're not going to invest $500 million, okay, in a study and come out and say, don't buy our drug, it sucks. So we're seeing a lot of it. So what you're saying is no more than a reflection of what they are saying, and you've personally experienced that.
Yeah, and more people are. It is such an obvious problem now that many of the mainstream people are speaking out.
Even the physicians are beginning to question.
Yeah,
and look at the direct-to-consumer ads and all the problems that come with that.
Right.
Big deal. But I want to take this back to this whole subject of AIDS now. We talked a little about HIV, the test, and some of the reasons why things are like they are. Tell us what AIDS is. I mean,
it stands for, the letters AIDS stand for Acquired Immune Deficiency Syndrome. Okay. This acquired immune deficiency syndrome has been known long before what we call AIDS with the capital AIDS. It was principally in people who were malnourished or premature babies, for example. There was good examples of this after World War II when the Allies went in. They looked in Germany and they saw the consequences of malnutrition.
Sure.
And AIDS popped up among these children especially, and even some adults, just malnutrition. In fact, malnutrition is the world's leading cause of acquired immune deficiency.
Well, that shouldn't be a surprise. I mean, it makes sense.
No surprise.
If you don't have enough of the nutrients you need to take in, your immune system's going to go south. It can't do the job it's supposed to. So you've got an acquired immune deficiency syndrome.
That's
and
right.
the problem is the word AIDS is more charged.
Right.
People don't think what AIDS stands for.
Right.
They just think it's this horrible disease that happens because of HIV and in gay men and drug users.
And sexually transmitted.
Right.
In the industrialized world, the principal causes of acquired immune deficiency is drug treatment, chemotherapy for cancer, for example, and also drug therapy like cyclosporin A for organ transplant patients.
Okay.
The cyclosporin A is
So we're trying to interfere with immune competence.
with the organ transplant drugs.
Yes.
You intentionally depress the immune system so that the patient doesn't lose the liver or the kidney or whatever.
Exactly.
But you have to titrate it, you know, or they'll get sick with AIDS diseases.
Well, you might kill them.
You kill them. You can kill them with it. So those were the principal sources of AIDS, acquired immune deficiency syndrome, around the world.
Okay.
Recreational drugs. Peter Duesberg and I have documented over the past 100 years that chronic use of heroin and cocaine and amphetamines and the poppers, the nitrite inhalants the gay men use almost exclusively, can cause AIDS-defining diseases. And that explains principally why the gay men, for example, were so disproportionately among the gay statistics.
So all you're saying is that these people with these kinds of lifestyles have immune deficiency problems.
That's right.
And it's acquired.
Right.
Okay, so it's AIDS.
Right. And the CDC understood this as early as 1982. They actually had it figured out. It wasn't rocket science. All this stuff is known. But then after that press conference, Robert Gallo was the one, you know, who said that his retrovirus, and then he was the one that said it probably came from Africa, and it's probably sexually transmitted. He's a retrovirologist. He should know better that...
that's by decree again.
By decree, that retroviruses are not sexually transmitted. They're not. And even if they were, they're totally harmless.
So he had a lot to gain from this.
He did. He became
a lot of money.
Millionaire.
Yeah,
on
at
his
least a
HIV
millionaire.
test. At least, yeah.
So the HIV test, and then he takes a stand against anybody who has an argument against that by decree again.
But he was quietly pushed out of the NIH in the early 90s because of some very controversial work. In fact, he was convicted of scientific misconduct for basically stealing the retrovirus that we call HIV from Luc Montagnier.
The Frenchman.
Right. And then I believe it was the Reagan administration that came in and said, no, we can't have our big discoverer of the cause of AIDS being convicted, so they changed the rules, you know, and then throughout the conviction, but quietly they forced him out. So you hardly ever hear anything from Robert Gallo anymore.
That's right.
You know.
Now, we talk about treating acquired immune deficiency syndrome, AIDS, with drugs that are very toxic.
Right. The chemotherapy for cancer, basically.
So it's doing more to suppress the immune system.
It does, and they're extremely toxic drugs. There's not an HIV drug on the market that does not come with a black box warning label. That's the most serious warning that the FDA puts in a label before they pull the drug off the market.
Could it be that somehow, for reasons we don't understand, that the drugs are used, like AZT and others, to treat people with AIDS, have a beneficial effect on them, on their disease in some way? Is that possible?
It's always possible for that to happen. Is it probable? I mean,
Can we explain it would be a better way to say it.
Right, can we explain it? They probably can, but what is really clear in the literature is that these drugs, in mass, on the large numbers of people, you know, 95% of the people for sure, do worse on these drugs than people who don't take them.
How do you know that?
It's in the mainstream literature itself.
So you can quote the articles that say that. Why don't the doctors look at that? Or is that your question?
MDs, basically physicians, practitioners, do not read the scientific literature.
So they're basically following CDC recommendations.
Yeah, that's true, but they also, you know how they learn about drugs, the pharmaceuticals? They learn about the drugs from
the drug company.
The drug salesman.
That's right. A
that
lot
sends
of times
it to
that's
them.
true.
You know, they don't read the primary literature on this stuff.
Well, don't include me in they.
No, absolutely not. That's why we're here.
That's right.
It's because you are not a they.
All right, so these drugs then that are using to treat immune deficiency are actually causing it. Is that what you're saying?
Yeah, they weren't actually designed to treat immune deficiency. They were designed to kill HIV.
Okay, that's what I meant by that.
Right.
Okay.
Assuming that HIV is destroying the immune system. However, as you mentioned, AZT, DDI, 3TC, D4D, and all these other nucleoside analogs were developed in the 1960s as chemotherapy for cancer. They're chemotherapy for cancer. Right. No physician would prescribe cancer chemotherapy for the lifetime of the patient. They would be taken up on charges for malpractice because the chemo will kill the patient if they stay on it for life. Right. But yet, if you're HIV positive, if you happen to have antibodies that react on the Abbott Laboratories test or whatever you call HIV positive, the standard of care is now to give you these drugs for life. Wow. And these drugs can kill you. In fact, they do kill you. And since, I think, the late 1990s, the leading cause of death among HIV-positive Americans is liver failure.
Right. Caused by the drug.
Caused by these drugs. And now, since, again, about the mid-1990s, there's a new problem. The AIDS establishment is sweeping this under the rug, and they're giving it a new name. They're calling it IRS, for Immune Reconstitution Syndrome.
That's as bad as IRS, Internal Revenue Service.
Yeah, that's easy to remember. And these drugs are causing exactly the same AIDS-defining diseases that the CDC came up with in their clinical definition of AIDS. What makes them called IRS, or Immune Reconstitution Syndrome, and not AIDS, is because these diseases now only pop up after people start taking the antiretroviral drugs, on weeks to months.
Wow.
They're exactly the same diseases as AIDS, so instead of calling them drug-induced AIDS, they're called immune reconstitution syndrome.
Well, that's sweet. That just avoids.
And it's a huge literature on this now, and whole conferences are devoted to this problem.
Now, this is interesting because maybe most of the doctors don't read the medical literature and do it seriously, and they do kind of what everybody else in the profession recommends because those are the standards of practice in the community. But the pharmaceutical companies know this.
Yes, they do.
Because they make the information up.
So does the
NIH. The CDC must know it.
They do.
Okay, and yet they're perpetuating this myth.
Right.
Anyway.
Well, okay. You know why it has to continue?
I think I do, but you say it.
But I'll say it. All a person has to do is imagine, just imagine that what we are talking about here is true. Yeah. That AIDS is not contagious, it's not sexually transmitted, it's not caused by HIV. The anti-HIV drugs are killing people and causing AIDS-defining diseases.
Wow.
And on top of that, there's no such thing as an AIDS epidemic in Africa, and we can talk about that.
That's another subject.
That's another subject entirely. Now, if all of that is true, we spent $250 billion on this bogus blunder, this biggest scientific medical mistake of all time.
The germ of lies, huh?
Germ of
lies. The title of your book.
Right. Then what is the likelihood that the directors of the National Cancer Institute, the National Institute of Allergy and Infectious Diseases, Secretary of Health and Human Services, or any president of the United States is going to say, "Oops, folks, sorry, we made a mistake"?
Yeah, right.
What is the likelihood of that happening now?
Well, I guess it's not too good because it hasn't.
The CDC actually, when Peter Duesberg had his article back in 1987, in Cancer Research, where he critiqued the whole thing about retroviruses in general, HIV in particular, and how they could not cause any disease. The CDC, Peter was able to lay his hands on an internal memo that was going around that said if this got out and the public knew about it, nobody would ever believe us again. Right. That's it. That's basically it. It's not even about money anymore, really. It's about face saving. It's about the whole infrastructure or edifice of the healthcare system in the United States, possibly the whole institutional form of government would be seriously undermined by the fact that this huge $250 billion mistake was allowed to happen, and it's continuing to happen, and the people in the government know it. They absolutely know it.
There's also got to be pressure, too, because from the point of view of the pharmaceutical industry, we know the hold that they have on the FDA, on the Congress, because they've got a lot of money, and they have more lobbyists than any companies in the world. And so they can buy their way out of a lot of this, I think.
They will come out of it clean. You know why? They're just going to the next disease, the next drug. It's the federal government is really keeping this alive. It's not the drug, because
Okay.
they have their institutions that they have to consider.
We've only got a couple minutes left, and I want two subjects I still want to cover. One is the HIV kids.
Yeah.
Okay, these
right.
are kids that are HIV positive.
Right.
They're healthy.
Yeah.
If the parent won't follow the advice of the doctor and give them the AZT drug, Child Protective Services comes in and says, we're going to take the kid away from you.
Yeah.
What do you think of that?
It's horrible. I've been involved in a number of these cases on the side of the parents trying to keep their kids from being taken away and being poisoned on these drugs. And I've known a number of cases since the 90s that I've been personally involved in on a legal basis. It's horrible. It's absolutely horrible. These children and parents have absolutely no civil rights when it comes to health care. And that is an abomination. And I hope that these court cases, we need to put these things on trial. We need to take a lawsuit, or make lawsuits against GlaxoSmithKline, and these other places that are killing people with these drugs. Right. To not so much that I want to hurt them, which I don't care about that, though, one way or the other, but it's got to be publicized somehow, and the best place to do it is in the courtroom.
And that's where the data you can bring from the studies that have been done that are in the scientific literature that show all the things that you're talking about.
Absolutely.
Because they're a matter of public record.
Absolutely. It's
now,
easy to come by if you really want it.
Okay, so now if somebody is HIV positive and you want to do, if you're going to do anything for somebody that's like that, you would probably propose doing nothing. But
yeah.
if somebody comes to you and they have even acquired immune deficiency syndrome, they have AIDS, how would you propose treating them? You use lifestyle things? You support them? I mean,
I tell you what,
we've only got about a minute or two left.
Sorry.
So I don't know how you're going to do that.
I'm not a physician, but I know one thing.
But you know a lot about this.
I know a lot about this. I would treat symptoms, you know. I mean, if it's malnutrition, feed people. That's what we did in South Africa. It works like magic. It's amazing. They get better, really, right before your eyes almost. You don't treat them with toxic drugs. You don't. I would tell people, I'll even make it even more blunt. We need to outlaw the HIV test. We need to outlaw these tests. They're horrible. They kill people. The tests kill people because then they go on and they take the drugs and the drugs kill the people. Nobody, I would say nobody should take an HIV test. They should refuse every opportunity or any pressure to take an HIV test. Don't do it.
Can anybody force you to take an HIV test?
You can if you're in jail, for example, and they've tried to make, in some states they force, it's on a state-by-state basis. And anybody who's ever had an HIV test, totally forget about it. Erase it out of your mind if possible. Now, if you can't, then the HIV test is so unstable that the result depends on what day you take it on, where you go, and who looks at it. It's totally arbitrary.
So it might be negative one day and positive another.
Exactly. So if you're positive and you really, really want a negative, just keep taking test after test until you get the negative, and then use that result.
Okay. So maybe that's the thing to do for parents who have HIV positive kids who are doing well. And what you're saying, basically, if I understand it right, is look at the disease, don't look at the label that's put on it.
Exactly.
And then do what you can to support that illness, doing the safest things you can that are possible.
Safe.
At lifestyle first.
Yes.
Get the healthy diet, do exercise, do the kinds of things that you can do to keep people to get enough rest, reduce the stress in their life, keep their weight down, make sure they have a meaningful purpose in their life. We do all those things that doesn't work, then we move on to things that are a little bit more aggressive, but certainly not thinking about using anti-cancer drugs for a disease that's been fabricated and probably doesn't even exist. That's the position you would take.
Absolutely. I mean, I couldn't have said it better.
It's such a privilege to have you on this show, David. Thank you so much for being here today. There are not too many people who have the courage that you do to have stuck out for so many years in an area where the public is not really receptive to hearing what you're saying, and physicians get angry with you. I've tried to put together a couple of AIDS conferences, which you know, that include you and Peter Duesberg, and have invited physicians to be there, and I've had no luck at getting one physician to face you or Peter. That tells me something. It means that some of what you're saying has to be true, and that the doctors know that, and they don't want to be involved in a position that's going to get them in trouble with their medical board or their colleagues.
You pay a serious price to speak out on this. It's cost me, it's cost Peter. You know this well. It could cost anybody.
It's a pleasure to have had you here today.
Thank you.
Thank you, David.
I've enjoyed it.